first, and then we can play with the Snoo. So you can keep your camera off right now for a little bit. But I will go. How does anybody know very much about Snoo? Is this all brand new for everybody? So I can kind of get a feel for how in depth I should go.
Brand new on my end.
I think it's pretty. I think it's pretty new on everybody's end. I think a few people might have had. I don't know, a few people, maybe one or two said they used it with their children, but I think it's pretty new for everybody.
All right, great. All right, so what I'm going to do is I'm going to go ahead and I'm going to share my screen, and we'll go ahead and get started. And I'm going to leave a lot of time. This is supposed to be really interactive, so I'm going to give you time to ask questions so we can pause and go over everything, and then we'll do the fun hands-on part. My colleague, Kelly, who's not with us today, she is a NICU nurse by trade, and she says that you all love to play with things and try and break them. And so keeping, with that thought in mind, let's have some fun with it. All right. So I'm going to go ahead and share my screen. All right. Can everybody see my screen?
Yep.
All right, fantastic. Thank you. All right, so Snoo was the brainchild of Dr. Harvey Karp, who was a pediatrician here in Los Angeles. And he wrote a book quite a while ago, about 23 years ago, called The Happiest Baby on the Block. I'm not sure if you're familiar with it. It's been around, it's been a bestseller for many, many years. It is the theory of the 5 S's. And how if you use the principles of the 5 S's together at the same time properly, it causes a calming reflex in the baby's brain. The 5 S's are shushing, swaddling, swinging, sucking, and side holding. We know that we don't do the side holding, the putting babies on their sides or on their backs now, or on their stomachs, but we do know that these other things work together. So about 15 years ago, Dr. Karp had retired, but he was noticing that the reduction in infant deaths had not gone down. So he came out of retirement. He worked with the media labs at MIT. Took him about 5 or 6 years to create what's called the Snoo. The Snoo does 3 out of the 5 S's. It keeps the baby securely on their backs. It does the swaying, the swinging, the swaddling, and the shushing. You put a pacifier in the baby's mouth. That's 4 out of the 5 S's. The reason why this is so important, as we'll go along, is that this is something that can be trainable and teachable to families, and that helps set them up for success. So we started off in the commercial end of things. We are selling directly to consumers. During the pandemic, when the cuddler programs had to stop, we donated to about 40 different hospitals around the country just to try and help them out. What we didn't realize was that they were going to be so popular, so happy, so helpful, and that clinicians loved them. We ended up doing 2 surveys, 1 year and 2 years after the start of the pandemic, and found that it does reduce nurse labor. It's about 2 hours per day per shift. That's like a 12-hour shift. Because it soothes the babies. We found out that clinicians loved it. They also found out that a lot of clinicians were using it for NAS babies and NOWS babies, which we didn't really realize at the time. So we were so surprised and really thrilled about that. So that's how we ended up getting into the hospital market, and that's why we're talking today. So, all right, so I'm going to go over the science of sound, motion, and swaddling. So white noise, as we know, is recognized as a way to enhance sleeping and as a calming effect. Most of people use some type of white noise, whether it's an air conditioner or the TV or radio or a white noise machine, as adults. And babies certainly are so used to that when they're in utero because of your, mom's heartbeat and the movement and the blood rushing through. So babies, the intrauterine sound levels are about between 72 and 95 decibels. When you're shushing your baby when they're outside, after they've been born, it's even quieter than that. They have done a lot of research on this. They found that the sound levels have found no negative physiologic responses to the infants. And it really helps them become used to the outside world, just like it does with the motion. White noise has been found to help reduce premature infant pain profiles, heart rate, respiratory rate, and increase oxygen saturation in premature babies as well. And let's see here. And this in conjunction with motion, again, something that the babies were used to in utero, the rhythmic motion, whether your mom is walking or driving or bouncing on a yoga ball or going up and down stairs. Babies are very, very used to that motion. And the sensory stimulation really accompanies that motion process, synchronizing action in the brain, which also helps the internal sleep rhythms. And swaddling, we've been swaddling for thousands and thousands of years. They have found that having arms down at the sides has been most effective for sleep efficacy. We know that some babies don't like it. We know that in certain situations, it's better to have the baby's arms across their chest or even unswaddled. But the very, very first few months of babies, their startle reflex will wake them up from the sleep. So that's why it's also very helpful to have them swaddled with their arms unable to touch their faces. With the Snoo sock, I will show you that in a little bit, but you have options. And then bringing this all together, the Snoo is also the key concept of the fourth trimester. Doctors theorize that babies are born 3 months too early for brain maturation. If a horse is pregnant for 12 months, foal is born, gets up on its feet, and runs away. If we were, as humans, to give birth, stay pregnant for 12 months, I think civilization would die out. I know I would not want to be pregnant for 12 months. So the theory is that babies are not really quite ready after 9 months. However, here they are. They're coming here. This is why newborns do best when they're given many hours a day of holding and rocking and sucking and skin-to-skin contact. And what we have done traditionally is we give birth to the babies, we stick them in a bassinet or a crib. There's no white noise, there's no motion, basically sensory deprivation from the second that they're born. And we see that Snoo helps to do everything that they need to do. It helps them to increase their brain development. It helps maturing their brain stem sleep regulatory abilities, and it has shown comparable neuronal transmission and motor evoked potential.
All right.
Work me thing.
Yes, and I just fucking got out of it some kind of way.
All right, I'm going to stop there
Yeah.
for a second, see if anybody has any questions. Does anybody have any questions for me? Are we still good? All right, so the theory of the 5 S's, and we recommend, so with your purchase of their Snoos, you got a certification complimentary. We do recommend that you have one person who is like a super user who gets trained up on the certification for the 5S's, and we recommend teaching the 5S's as part of your discharge packet. You teach your families how to swaddle. You teach them how to feed their babies. Might as well teach them how to soothe a cranky baby, because we all know that babies are going to get cranky at some point or another. And so this is a really great way to help set them up for success. Like I said, the Snoo started off as a book and a process to do the 5S's without the Snoo. So it's very easy to be able to become a Snoo as well. I'm just going to sort of flip through these because we've already talked about what the 5S's are. We do also offer handouts and videos to give to the families at discharge. And I think all of this stuff has been sent over to your supervisor. All right. And if not, then she will bonk me over the head and I will make sure it gets sent over. All right. So the 5S's are the effective non-pharmacological strategies to help reduce crying and improve the sleep. And studies do show that Snoo was helpful in reducing crying and improving sleep during normal infants. All right. And it has also, we've done, Kansas City Children's has actually did a study on their post-operative babies, and it helped reduce their stress and helped improve their recovery after surgery. All right. And so again, all of these, the instructions are going to be sent over to you. The flyer that we have for your families is written at a 3rd grade level. So it's very easy to understand. It has these cute little pictures. Again, we're just going through the 5S's and then putting it all together again. It really does help set the families up for success. And let's see here. The 5, it may seem strange, it may seem a little odd to be doing these things, but if you've held a baby, you find that you sort of naturally start the swinging and the rocking and the shushing and in some sort of form or another, even holding the baby sort of on their stomach or on their side. So a lot of this is just done naturally. And that's something that, again, is very, very easily teachable. All right, so how Snoo works. Snoo is a responsive bassinet. It's the only bassinet that has the FDA de novo authorization for keeping babies safely on their backs. And that is because it has these wings that attach to clips right here. And I'll show you that when we get over to the show and tell part. But right here underneath the baby's head has microphones and speakers, and the microphones will pick up the baby's cry, and the speakers will send out a higher noise level. So when you put the baby in, you turn the button, you turn it on, and you have low white noise and motion, and it'll just keep going white noise and motion. When the baby starts to cry, it will increase the white noise and motion. Now, it will, about 50% of the time, it will soothe the baby within 1 minute. The rest of the time, if the baby needs something like a diaper change or a feeding, because it will not soothe past hunger cues, it will time out at 3 minutes. But if the baby just needs that little extra help getting, bridging one sleep cycle to the next, it will increase the white noise and motion. The sensors will know when the baby has stopped crying, and it will step back down after 8 minutes. If the baby starts to cry again, it will step back up. It could be going up and down for 20 minutes, but eventually it will go back down to the baseline if the baby falls back to sleep. The Snoo is safe for infants about 33 weeks gestational age, or about 4 pounds, as long as they can self-thermoregulate, and through about 6 months of life, or about corrected age, or about 25 pounds, as long as they are not doing flips, or they can get on their hands and knees. As I mentioned before, Snoo is great in the critical care settings. It is good for all levels of the NICU. We have seen about 80% of our hospitals using it for fussy babies, NAS exposed, substance exposed babies, and also post-surgical babies. Also pre-surgical babies. We have a couple of hospitals that use them for babies who are waiting for heart surgery and post-operative. And it helps reduce their stress and helps aiding in a quicker recovery. We are seeing them moving into more of their baby rooms. Even if their mom is getting an extra 15 minutes of sleep, to us, 15 minutes doesn't mean much, but to a new mom, 15 minutes can mean the difference between being awake enough to feed their baby and put them back in the bassinet, or waking up, putting the baby on their chest and falling asleep with the risk of dropping the baby. The other thing that it does is that it does show putting the babies are in a safe sleep environment, and you're practicing safe sleep, modeling safe sleep. Parents see and will mimic what parents will see what you're doing, and they will mimic what you're doing. If they see you using a swing or another bed type that is not safe sleep oriented, they will say, oh, well, the hospital did that. I can go home and buy a swing and let my baby sleep in it. So this really shows, even if their baby is not in the Snoo, they will see that you're using safe sleep. The other thing it does is it has parental peace of mind. Like if the child is still in the hospital or has been readmitted, and the parents are not staying there, that they know that their baby is in a secure, soothing environment. This is our basic exclusion and inclusion criteria. Again, you will be making your own protocols, but this is just something that we've put together. And of course, we've shared this with your leadership team, as well as at the end of the training, we'll send this entire deck over. But it's, safely thermoregulate, 33 weeks, for inclusion, exclusion, any neurological or spinal defects, post-neurological surgeries. Again, you're going to have your own protocols on who you're going to be using your snooze with. And so that will be something that you will talk amongst yourselves. The thing is, this is just sort of side-by-side comparison. Right now, Snoo does more than any other bassinet does. It's fully has the gentle motion, and it's safe, and it has storage, and it is clinically tested. The sounds are specially engineered. A standard bassinet, this happens to be Stryker, and it's twice as expensive as ours, and it does nothing. So we're hoping that this is the new wave. What you can expect. Snoo's going to be an extra pair of hands. As I mentioned before, you're going to save probably about 2 hours per shift. I'm not saying every single day, but on average, and we've heard this over and over and over again, we're in 190 hospitals, and the constant feedback is about 2 hours per shift. That doesn't mean anybody gets to go home early, but it does mean that you actually get to go home on time or get all of your work done, or your top of license work done. Number two, it will soothe those substance-exposed infants and those really fussy babies. Just talking to a hospital last week, they had a frequent flyer who keeps coming in, who they just know that when that baby's at the hospital, that baby's going to be crying 24/7. They decided to put the baby in the Snoo, baby was crying, they walked out, came back a minute later, baby was knocked out, sleeping. So they were thrilled. Again, and promote safe sleep, can't address that enough. The reason why we got into this was to reduce infant deaths. We're eventually hoping that we are working towards getting this covered by insurance so that every family can afford to have one. And we also want to be able to support you as clinicians. We don't just give you the snooze, say, hi, good luck, here's your training, see you later. We will be a part of your ongoing team to help support you along the way. Another thing that it does is it gives patients a better patient experience. We have pregnant families who call us and email us saying, hey, can you see if my hospital has Snoo? Because I'm giving birth there and I really want them to have a Snoo there. So sometimes it could be the difference of, somebody will choose your location over another. And the families just are really embracing it. So I'm almost at the end of my chattering. Does anybody have any questions? Okay. All right, so I'm going to show you this, and then we'll get into the show and tell part. So you're going to have the mobility cart, which is right here. This where the handles are. This is the end where the baby's head is going to go. That's the same end where the microphones, the speakers are. And I'll show you that in just a second. The mobility caddy has doors that open on both sides, and it has shelves. You're going to have a hospital grade mattress. You can use the infection control cover to go over the mattress if you want to. If not, you can just wipe this one down with Cavi wipes or any other hydrogen peroxide based cleaners that you have. This is the Snoo bassinet without the covers, and I'll show you how to clip the baby in. This is the disposable mesh cover, and I'll show you how to use it. This is part of what I recommend you do when you get a chance to go over and play with the Snoo is practice putting this on. I will show you how to do that in just a minute. And then the Snoo sleep sacks. I'm going to get a little bit more into this in just a moment. And then the fitted sheets. Those are the organic cotton fitted sheets. They will go on top of the mattress. So what's actually touching the baby's skin is all organic cotton. Okay, so I'm going to stop sharing for just a second. All right, any questions? We all good? All right, fantastic. Hi, Skylar. All right, so here is your Snoo sack. I want to talk about this for a little bit before we go switch cameras. So here are the wings, and on the wings are little holes, and this is what you're going to attach the Snoo into the clips with. Okay, the Snoo zips two ways. It zips up from the bottom, so you can put any lines in that you need to for the foot or change the diaper. And then from the top down, I go, let's see here, unblur so you can. All right, and then here is where you swaddle the baby. You have the swaddle right here, and this is just an extra diaper piece to make them extra secure. You can swaddle arms down like this, like we talked about earlier. You can swaddle with the arms across like this. Sorry, somebody's trying to come in. You could have their arms out in a little capsule right here. And you could also have their arms hanging out right here. Okay. I'm just going to do a quick check. I see somebody's trying to get in and they're having trouble. Can anybody still hear me?
Yes.
Perfect. All right, great. So I hope this person can get in. And I hope that I can get in from my other phone. All right, so what I'm going to do is I am going to transfer to my cell phone so we can actually play with this, with the Snoo. And Skylar, do you also, if you want to try going online as well? All right, can you hear me?
Yes.
All right, fantastic. And can you see my Snoo?
Yes. Yes.
Fantastic. Thank you. I'm sorry, when I have my screen on, I can't see anybody, so I rely on verbal cues. So here's your Snoo. Here is the speakers and the microphones. And here are the clips. As you can see, Skylar, all right, Skylar's showing you guys a great picture. You can see the Snoo setup, and you can see the caddy, and she's got the cover on. And so I'm going to show you. But you'll see the cover has these little holes in it. You're going to just fling the cover on. This one's a little loose because I use it all the time for training. But what I recommend is that you just sort of throw it on. Doesn't matter how loosey-goosey it is. You just put it, attach it in, and you're going to line up the holes with the clips. It can look like this. It can look silly. It doesn't have to be great. And then you put your mattress in. And then you can neaten it up. Do what you need to make it all pretty. Okay? And then we have our baby. And the Snoo is not going to, let me back up. So with the infection control covers, you can use them for up to 7 days with the same baby or until they get soiled. Or when you switch them out for each new baby. Okay? The Snoo is not going to turn on unless the baby is securely attached. Right? Because that's part of the safety features. And as you can see, there's lots of room for the babies for good hip movement and so they can kick their feet or whatever. And also if you have a long baby. As you can see, this baby likes to have her arm out. She likes to suck her thumb or wave. And so then at the far end, and Skylar, you could probably show them, there is a button. It's white, has it's a white button, and it has a white light around it when the Snoo is plugged in. What you need to do is you just push the button, and voila, you can just walk away. Now, one of the things I want you to play around with the most is playing around with the activity button, because what you can do is you can press and hold the button for about 5 seconds, and it will increase the white noise in motion. Now, your Snoo will have what's called a motion limiter on.
Erica, sorry to interrupt you. Some people say they're not able to see you. I can see you, but some people are seeing like just a screen that looks like it has, I don't know, it looks like almost like white chairs on it or something, white cushions on it, but they can't see you.
Oh, how strange.
It's a bunch of white, looks like a white chair.
I don't have a white chair.
It's very, I don't know.
That is so strange.
Is anybody having problems besides Natasha?
No, I can see her just fine.
I can see her too.
Well, okay.
Can Natasha see me at least?
Oh, Trish says she can't see also.
That is so weird.
I can see.
Can you see me put a pink thing over the baby?
I can see too.
Oh, she said she can see it. Yeah, you're clear as day for me. Joe, Trish said she can't see it actually, so maybe it's just Natasha having issues for whatever reason.
How strange.
Oh, Sue says all she sees is a black screen.
I've never had that before. Can you guys see Skylar?
Tech savvy ladies. Can y'all see me?
Yes, I can see both.
my bed.
Can they maybe
least.
log out and then log back in?
All right, I'm going to log back into my computer. We might get an echo, but let's see what happens. You can see me, right? Just my face now, right?
I can see it now.
All right, we're all good? Yay! Gotta love teams. So here we go. Baby's just nice and quiet. If the baby's really asleep after 40 minutes, the white noise will even go down an extra level. Now, when you put the baby in, if the baby's already fussing and you want to make sure that you increase the white noise and motion a little bit, you want to go over and press and hold the button for about 5 seconds. This is the part that I really want you guys to learn to play around with, because if you don't hold it long enough, it will shut off, which will make the baby angry, cranky. But if you hold it for 5 seconds, it will manually increase the white noise and motion. And you can do that up to level 3. Now, we do have motion limiter on your snooze, so you'll only have 2 levels of motion after the baseline. So you have baseline, level 1, and level 2. Level 3 and level 4, you'll only have the white noise increase. And the reason for that is that in most cases, newborns don't need that extra level of motion. If you find that you're going to be having a lot of repeat guests, then we can give you the override on that. It doesn't change the IFCs or IFUs, but we can certainly give that to you. I think only like 3 of our hospitals have actually used that. But again, every hospital uses them a little bit differently. The other thing that we do recommend playing with and getting comfortable with doing is pulling baby out in case of emergency. You don't want to fuss with trying to unsnap the baby and all the rest of it. If there's an emergency, you would just pull them up out of here and take care of the baby. All right. The Snoo will not turn off. Will turn off as soon as the baby is unclipped. We've actually had many clinicians come to us at conferences who have done that, who've come in and practiced taking the baby out of the clips to see how fast you can do it. So I do recommend you playing with that and playing with the activity button to get the feel for turning it on and off and for increasing the white noise and motion. But I'm going to go back to my computer. Skylar, how are you doing?
We're great over here.
Okay, good. Are you getting a feel for the button, the activity button, and the pulling the baby out and things like that?
Yes, my wonderful model Elise just represented that for us as a trial run.
Oh, excellent. Excellent. Does anybody have any questions? I know it's pretty late for you folks, so I want to make sure we get you all covered. If anybody has any questions, this is a huge group. This is really, really cool. And I'll make sure that all of you get credit for attending.
Erica, you said this, but I missed it. So when the baby's in it and baby starts fussing, does it increase the intensity and the noise as the baby fusses, or no?
Yes, it does.
It does. Okay.
It has 5 different levels, and that will be on this training document that I'm going to send to you, Karen.
So the pressing of the button to increase the intensity and the noise, you don't have to do, or because it's going to automatically do it, or?
It's going to automatically do it. If you want to preemptively, like if you're already putting a baby down that's a little fussy and you just want to go straight from baseline to level 1, you can press and hold that button.
Okay, gotcha.
But you don't have to. You can just like put the baby in and see what happens. But like I said, if you want to if you see somebody who's kind of cranky and kind of going there, then you can just preemptively push that button and get them going a little faster. Okay, so yeah, that's why we want you to get in there, hands-on, play with it, really get a good feel for it. To be honest with you, that was the hardest part for me, was pushing that button and doing the press and hold. That's why I really encourage you folks to all. So, any other questions?
I can leave the bed plugged in, and when night shift comes in, if you guys want to play with it, I can kind of help you.
Thank you, Skylar. Thank you for your help, Skylar.
Of course.
All right. Well, one of the things that we found, our marketing did a sort of a search and found that about 70% of our snooze are purchased between midnight and 3 a.m. local time. So it has to be easy to use because people are exhausted. So I think once you get used to it, you'll find that you'll want to use it for as much as possible. And again, we are here as a resource for you. Karen has my contact information. And Kelly is on the East Coast. I'm on the West Coast. So there's usually one of us around. So if there's anything that anybody needs, if you come up with any questions, please feel free to reach out. Okay.
Sounds good. Thank you. Are you doing the one tomorrow also?
I am.
Okay. Sounds good.
All right. So everybody else who didn't make it today, they'll get me tomorrow. All right. All right. So thank you, everybody.
Thank you.
And have a great evening.
Thank you.
All righty. Bye.
Thank you. Bye.